complex condition that demands a comprehensive approach. These are the words of Dr. Manan Mehta, who's a renowned dermatologist and also the guest for today on Times Now Storymakers. My name is Shefta Khan, and it's my honor to host Dr. Manan Mehta for today's episode. He's trained from the very prestigious Sri Ramachandra University, and he's going to bring expertise in the field of clinical dermatology. He's going to dive into the field of skin and hair transplantation. What is the procedure, the cost, and the recovery period, and the most important, who is supposed to get a hair transplant done and who's not. For more such insightful information, we'll have to dive into this episode. So without further ado, let's welcome Dr. Mehta on today's episode. Hello, sir. So please tell us about your journey and what made you get into this hair transplantation journey.
Sure. So I'm Dr. Manan Mehta. I'm a consultant dermatologist and founder of Avya Skin Clinic. My journey began in 2005 when I went into my undergraduation course in Pune of MBBS. After 5.5 years of completion of my MBBS, after that I worked for some time in dermatology department in various government hospitals. And I developed my interest in skin specialty, dermatology. And following which, after 2 to 3 years later, I started my post-graduation from Chennai. And I completed my post-graduation in 2018. After that, I worked in top hospitals in Delhi NCR. And in the meantime, I also did my master's in hair transplant from American Academy of Aesthetic Medicine. And this was done in Dubai.
Oh, all right.
Yes.
So what made you do specialization in hair transplant?
I was always interested in hair transplant, and I was very fascinated by the hair subject. So that got my interest perked up. And I also did certain fellowships and workshops after my post-graduation before entering to do my master's in hair transplant. Yes.
So you have done another master's in hair transplant.
Yes.
Okay. So what is this male pattern baldness?
So basically, male pattern baldness is also called as androgenetic alopecia. It's a very common problem seen in men. And it's basically baldness which happens in men at an early onset. And over here, basically, there are certain genes by which the person inherits these genes, and the baldness pattern follows in the families. So what happens over here is that the male hormone is getting converted into something else called as DHT, dihydrotestosterone. So the normal male hormone is getting converted into dihydrotestosterone, and this DHT, dihydrotestosterone, it basically destroys your roots. It starts to eliminate the root from where the hair follicles arise. And then certain signs of baldness start to occur in young age. That means there are certain grades. That means hairline becomes receding, and then there is thinning of the hair occurs in the second phase, and there is enlargement of the forehead, and there is recession from the sides, and then secondly, then there is miniaturization. That means the hair follicles become very thin. Yes. And then there is third stage, fourth stage, where there is hair loss which is occurring from the back side as well as from the front side. And genetics does play an important role because this hormonal dysregulation occurs at a younger age in people who suffer from male pattern baldness.
Okay.
Yes.
So do you believe that environment, food habits, lifestyle, these are the major problems?
Environment does play a certain role, but not very much so. Because people who are born in a family where the father is also bald or the grandfather is also bald, so they will also be very high chances that they will also get bald genetically at a younger age. By the age of 25, 26, they get completely bald. So I've seen cases and also done hair transplant on patients who are just 25, 26, but they will look like around 50, 60 years old. Yes. So the cosmetic angle plays an important role because they start to look at least 5 to 10 years or 15 years older than their age, their actual age. Yes, sir.
But if it is not genetically, so fooding habits.
Yes, certain habits, like for example, smoking has a bad detrimental effect on the hair growth. It also adds to the androgenetic alopecia. It can fasten the androgenetic alopecia. Too much of gymming or taking any kind of hormonal testosterones, ex- ex- exogenous steroids, that also fastens your hair fall. Yes, yes. Apart from that, alcohol can also play a role, and certain abuse of medications can also lead to hair fall. Yes, yes.
So, what are the like? You are an expert in hair transplantation. So, what are the techniques that goes behind the process of hair transplantation?
Yes, yes. Basically, there are two techniques. First technique is called as FUE, follicular unit extraction, and the second technique is called as a strip extraction, or FUT. So in FUT, basically, there is a little bit of scarring because we take a whole strip from behind, and we then there is a whole team of OT technicians who then separate the hair follicles, the hair grafts, basically. So the language in hair transplant is called as graft. So graft or roots, basically. The hair comes from its roots. The roots are where around 7 to 8 millimeters of depth below the scalp, and each graft contains around two, sometimes three hair follicles. So in strip, we take the whole strip and suture it. So there is a scar, but yes, more number of grafts one gets. But there is another technique which is scarless surgery, which is called as follicular unit extraction (FUE), where we use motor punch machines and we take out these grafts. That means the roots. We take out the roots. No, it's not done by suction. It is done by a specialized motor machine which the surgeon operates while doing the procedure. During the procedure, we give a specialized type of anesthesia called as tumescent anesthesia, which is a very diluted form of anesthesia. It's not the normal local anesthesia which we inject over the patients, because if we give too much anesthesia in the form of local anesthesia, the patient can develop neurotoxicity. Yes, yes. And so follicular unit extraction is very much very famous also. And the best part is that the holes are very, very tiny. So when we take out the grafts from behind, nobody can really make out that anybody has gone through a hair transplant procedure. Also, important role does play in the surgery is the hairline designing. How we design the hairline before the procedure so that the final outcomes come.
Turns out.
Yes, yes.
Okay. So, like, you've explained the entire process. How long does it take for a hair transplant?
Hair transplant surgery takes around 6 to 7 hours.
And do they have fittings?
No, it's a one-time procedure, and maximum number of grafts is recommended to get this surgery. And sometimes at our clinic also we give 1 hour of lunch break to the patient when we are done with the harvesting of the grafts. Yes, yes. In FUE, basically, we also create the slits whereby we make the holes and give a very natural look to the patient. And then there is a third step of implantation where we implant the grafts. So the graft's life is about 6 to 7 hours, during which once the graft is out from the donor area, then we have to transplant it within a span of 6 to 7 hours.
So, what cost can someone expect for a hair transplant?
Uh, a good hair transplant will cost somewhere between 1.5 to 2 lakhs
Okay.
at our clinic, and we also guarantee permanent results, because there is a particular area from which where we take out the graft. So that particular area, if we take out the grafts, that will always stay lifelong, and this hair uh, grows naturally, and the patient can also uh, hairstyle his hair. He can color his hair, whatever he likes. He can do that.
Okay. There are n number of dermats in the market. So, like, why should people approach you for a hair transplant? Because you are providing them a permanent solution throughout life?
Yes, first of all, we provide a very hassle-free journey towards hair transplant. It will make sure that the procedure time is shortened as much as possible, and the patient is very safe. The surgery is done very safely, and the patient does not feel any kind of discomfort. Is completely comfortable during the procedure. Most of the times, our patients don't even know that it has been already done. So that is very much important for the patient's point of view, and we also guarantee permanent results. Uh,
All right. So what are some of the common misconceptions people have about hair transplant?
so people nowadays have a lot of misconceptions regarding hair transplant. A lot of people find it to be very messy and very complicated, but that is not the case. So hair transplant is like a mini surgery.
Yeah.
It's like a very simple procedure, to be very frank, and it's a very miniature surgery. It's kind of microscopic surgery because we also use specialized type of glasses when we are doing the procedure.
Okay.
We wear glasses which magnify it 10 times so that we can see the roots properly, the grafts properly, the hair follicles properly, where to place the motor punch machine from where we extract the hair follicles. So it's a very microscopic kind of surgery.
Yeah.
It can't be told like a major surgery also. And so that is one. And some people also find hair transplant to be very bloody, a lot of blood work and like that, but that is also a misconception.
Is it not true?
It's not true because the amount of blood which actually comes depends on the surgeon. So if your surgeon has given the right kind of type of anesthesia, a diluted type of anesthesia, so then the bleeding will also get decreased.
Oh.
And there are other techniques always also where we decrease the bleeding, and other ways are there by which we minimize the bleeding for the hair transplant. So the actual amount of blood in the hair transplant is very less, around 400 to 500 ml.
Acha. Okay.
Yes, yes.
Also depends on how much experience you have in this industry.
Yes, yes.
Yeah.
Of course.
Okay. So how do you determine that if someone is a good candidate for a hair transplant or no?
That's a good question. See, actually, to decide whether a person is a good candidate for hair transplant or not, certain factors we look into. Number one factor is the age factor.
Okay.
So we don't prefer people who are very young, that is 18, 19, 20,
Till?
till around 23, 24.
Okay.
Ideal age should be 25, but we can also consider 24 years. And the ideal age is around 25 to 45 age group. That is the ideal candidate. And second factor which determines whether the patient is ideal for the hair transplant is your donor area.
Okay.
In some cases, most of the cases, around 80% of the cases, the donor area does not get depleted. So that means the donor area does stay for a long period of time in most of the patients. Till at the age of 55, 60, the donor area will be preserved because the nature of the disease of androgenetic alopecia.
Correct.
But in certain cases, we do see at a younger age when the donor area is depleted. So then that means our chances of the number of grafts will get reduced.
Correct. Correct.
So once the number of grafts is reduced, then we have to see for other options like beard area or body hair. We have to see for other options, but these are not very good options of beard and body hair because their life duration is not
Small.
their span is small as compared to the occipital area, the backside area where we actually take out the graft from.
Okay. Okay.
Yes.
So are there any cases from your experience when you said a no to a candidate? Don't go for a hair transplant.
Yes, there have been certain cases. I have seen a patient of mine who was 22 years old and he had low number of hair follicles in the donor area. So we had to refuse him for the hair transplant.
Okay.
Yes.
So this entire process, this entire journey is very emotional, and people go through a very emotional, situation. How do you help patients help through this time period?
Yes, yes. See, first of all, when we see cases of androgenetic alopecia who are potential candidates for hair transplant, we basically also, first of all, remove their myths about hair
Very
transplant,
important.
remove their fear or their apprehensions about hair transplant, that hair transplant is not such a major surgery. And nowadays, you can see everybody is also getting it done. And hair transplant, who's suffering from the androgenetic alopecia, they have problems um in getting married. They have psychological problems due to this, mental health problems due to this. They face inferiority complex,
Yeah.
which can be dealt with.
Dealt with.
And we motivate these patients also. And certainly with the hair transplant, it's a new life which we give to the patient, because the look is completely changed and the look is very natural in hair transplant.
Absolutely. So, people think it's a very hassle situation to land into, and you make it hassle free.
Yes,
Correct?
yes.
Okay. So, one case that you can just give an example to our audience who are watching. They were going through an emotional journey, mental breakdown, how it was affecting their personal life, professional growth, career-wise.
Yes, yes. So certainly, I had a case of a 26-year-old person who came to me, and he had grade 6 of androgenetic alopecia. That means he had
Okay.
completely bald. He was completely bald.
So, we have grades also.
Grades also, yes. Grade 1, grade 2, grade 3, grade 4. And so that means only the backside of the donor area was left. Front and parietal area side of the hair was
Okay.
completely gone.
Okay.
And he was having this for last 4 5 years. And we counseled him, and then we did the hair transplant surgery, which completely transformed his look. And he was having trouble in finding marriage prospectus for himself. So after that, his journey completely changed, and he because his look changed, so his confidence level also increased, and he had no problem in finding a match. Also, now he's happily married.
Yeah.
Yes.
Did he say thank you to you?
Yes, he did.
Yeah. Okay. So, what is the recovery process, and how soon a patient can expect a transformation or a result?
So immediately after the procedure, the patient is advised, we put a bandage over his donor area, which he can remove the next day and start applying a topical antibiotic cream over there.
Okay.
And after the procedure, he can go home, he can watch TV, he can also little bit, he can go to the mall also, he can travel also a little bit. There is not a problem with the traveling part. But we do advise against smoking and against too much of gymming. Little bit gymming is also advisable. You can do a little bit of weights, but avoid running, avoid swimming. These things should be avoided.
Okay.
And after the day on which the hair transplant surgery is done, after 5 to 6 days from there, the scabs are formed
Okay.
over the procedure site, and then the hair starts to grow like normal hair.
Acha.
And yes, this hair which grows like normal hair, because now the location is changed from the back side to the front side, they also fall off after 1.5 to 2 months.
Okay.
Because these are grafts, like these are transplanted hair.
Correct.
And after that, they follow the normal hair cycle.
Oh.
So the hair cycle is basically divided into 3 phases. Anagen phase, where the hair starts to grow and it keeps on growing for the next 2 years to 6 years.
Okay.
And then somewhere in between, it comes into the telogen phase, and in the catagen phase, it breaks down, and then again it follows the hair. Similarly, the transplanted hair also, they grow initially for 1.5 to 2 months, and then they fall off,
Fall off.
and then they again grow just like normal hair.
Like the cycle and the process starts again.
Starts again, exactly.
Okay. So, it's all about a hair transplantation, but it's also about a journey.
Yes.
Yeah, people go through.
Yes, yes.
Okay. Sir, there's this thing that people have recently started following. I don't know, it's a trend or what to say. People have started using wigs.
Mhm.
It is becoming a trendsetter now. Like, what narrative would you like to change?
So first of all, according to me, I've also seen many patients who wear wigs, and the reason behind that is, first of all, they don't believe in hair transplant.
They don't.
They don't believe in hair transplant. According to them, it's a very complicated procedure, just like I mentioned earlier.
Yes.
And they have their fears for hair transplant.
Absolutely.
Maybe the surgery will not go right, maybe this, maybe that. And these apprehensions lead them to wear a wig.
Wear a wig.
But certainly, this can be changed. This perspective, this thought process can be
Yeah.
changed.
Yeah.
And if you meet a good
Good
dermatologist,
yeah. So they can definitely shift from a wig to a hair transplant
yes, yes,
without even giving a second thought.
without even getting giving a second thought.
Okay.
Exactly.
Apart from this, apart from hair transplant, now because you're a dermat, renowned dermat, let me just say like that. Skincare.
Yes.
Everyone is talking about skincare. Every second person is very considerate about skincare. But do they really know about their actual skin? Like is it oily? Is it dry? Is it combination? Or what is it?
Yes, yes. See, there are many different types of skin. Skin types are there. According to the color, first of all, we divide it into type 1, type 2, type 3,
Yeah.
or grade 1, grade 2, grade 3, like that. So, grade 1 and 2 is not Indian skin type. And grade 1 and 2 is basically European or American skin type where they don't have melanocytes that much.
Yes.
Right? So, melanocytes, having more melanocytes is a good thing. It's not a bad thing.
Having a dark pigmentation.
Having a brown or darker pigmentation is a good thing because it is proven scientifically that having more number of melanocytes has some role against prevention of skin cancer also.
Correct.
Yes,
I agree.
so that is number one. And then Indian skin type is more of Fitzpatrick's grade 3, grade 4 skin type. So that is one. And then whether you have oily skin or you don't have oily skin, like that. So diet also plays a important role. So people who have acne, they also have dandruff. Most of my patients who have acne, they also have dandruff, and the reason behind that is that their sebaceous glands are quite big in size, and they're secreting more of oil. That is more of sebum. Yes, yes. So for these patients, it's advisable to avoid food which contain a lot of high fat and also high protein. Even high protein diet, yes, high protein diet also causes acne.
Oh.
Yes, yes. So we advise against high protein diet, and also milk and milk products. They also cause breakouts of acne. Regarding your question of following a routine, I do tell patients to, yes, follow a routine, certainly when they are after a certain age.
Yeah.
Because after the age of 28, 29, your skin starts to age faster.
Correct.
So facial skin is comparatively thinner than the rest of the body. And with age, the facial skin becomes much more thinner. So the sun damage is much higher.
Correct.
So the sun damage will not, which was not giving any kind of problems at the age of 20, 18, and now at the age of 35 or 30,
It is definitely giving
it will, yes, it will start to give pigmentation problems like melasma, other problems.
Yeah.
Aging. There is something called as photo aging also.
Yes.
So photo aging means that your age skin gets more wrinkled,
Yeah.
damaged.
And you look much older than your actual age.
Yes, yes.
Okay. So that one product that you swear by, or any dermat swear by, ki you cannot live without this one product in the skincare routine.
Yes, yes. So in the skincare routine, there is sunscreen, which we advise to almost all our patients.
Okay.
And apart from that, there is moisturizing creams.
Okay.
Sometimes we do recommend use of vitamin C serums. For like once a week or twice in a week.
Yeah.
I do advise certain patients who are looking for anti-aging treatment or
Retinols and all?
retinols. We do advise, but in a less percentage.
Okay.
So the strength of this retinoic acid cream or serum should be less. So I advise my patients around 0.3%, and that to be applied once in a week.
So, people who are of my age, who are 21, 22,
Yes, yes.
do you advise them to use retinol in their skincare routines?
No, I don't advise using retinol on a routine basis because retinol makes your skin thinner.
Oh.
Yes, yes. It is advisable for patients who are more in the age group of 35 to 45 or 45 to 50, like that. For them, they can use retinol once or twice in a week, and do use more of moisturizing cream. So before you do after your face wash, you can apply a little bit of retinol over your face, and then you can sleep and then apply sunscreen the next day.
Okay.
Yes.
So retinol is always applied before you're going to bed.
Yes, yes.
Okay. Skincare means women.
Yes, yes.
Is this a statement true, or skincare is also for boys or men?
A statement is also for boys and men also, because I see many people, mostly I've seen men who don't do any kind of skincare
They don't.
routine.
They just apply Lifebuoy on their face and they're good to go for any event.
Yes, yes. So for them also, we do always, whenever you go out, use a sunscreen
Okay.
and use sun protection. Also, like you can always wear a cap or a hat. Sun goggles is also good.
Correct.
Right? You can also use moisturizing creams. Vitamin C serums also you can start using once a week.
For boys?
For boys, and depending if you have open pores, you can also use a little bit of retinol serum,
Oh,
like that, once a week for some time.
okay.
Yes, yes.
So AM routine, PM routine, they do work.
Yes, they do work.
Okay, perfect.
Apart from that, also what works is your diet. If you
Yeah.
have more of fruits, vegetables, they have a lot of antioxidants, and antioxidants also decrease the free radical damage or the oxidative stress. So in we are living in an environment where there is pollution, there is
Yeah.
vehicular pollution, there is
Yes.
many things like that. So this is called that leads to something called as a oxidative stress. So which basically causes your aging process to be faster. This works in a cellular level. So when you have antioxidants in the form of fruits, vegetables, that also contributes. Apart from that, we also give other supplements like glutathione,
Yes.
which is also working quite well.
Yeah. Industries, brands have started incorporating such ingredients in their, products
Yes,
to attract the market audience.
yes,
Yeah.
yes.
All right. So we have come to the last laps of the show. And before leaving, I would really want you to please tell me that one advice that you would like to give to the people who are watching and are undergoing the hair transplant journey.
So my advice to patients who are looking for a hair transplant is ki, don't get afraid. Discuss with your doctor properly, and don't have any kind of don't believe any kind of rumors that the surgery can go wrong, or a lot of blood comes in the surgery and it will not be successful. So I have treated many of my patients successfully, and uh, we have given them a new life. So my suggestion would be, don't get afraid and consult the doctor and discuss with him. Feel free to discuss. Feel free to uh, discuss your fears.
Okay.
Yes,
Okay.
yes. And don't get afraid.
Don't get afraid. Just go through it. This time shall too pass, right?
Yes.
Okay, perfect. Thank you so much, sir, for being such a wonderful guest for today's episode. And we were glad to have you. And I'll be back with another episode on Times Now Story Makers. Till then, see you in the next one.